As Margaret, thank you for the introductions. I was at UCSF for fellowship for 3 years, and then I stayed on faculty at San Francisco General for another 3 years. Coming out of fellowship, I felt that I wanted to stay in an academic center, not because I'm a researcher, because I'm definitely not, but I love teaching, and UCSF as a facility is a great place to learn how to teach and to continue to teach. And so I had developed an interest in teaching endoscopy and had developed a simulator training program for the fellows that I had developed in my third year and wanted to continue it on. And so that's what I did, and I became an APD and the site director for our fellowship at San Francisco General. And I loved it. It was great day to day. San Francisco General is a wonderful hospital. The fellows are great. The people are great. That being, after 3 years, because I wasn't a researcher, I was a clinician who taught during clinical duties. The system, I wasn't sure where and how I was going to progress through the system, since most promotion is based on how you do research. And UCSF does a good job of having a clinician educator track, but I didn't mesh, and I didn't see where I was necessarily going. And this is not against UCSF. It's not against the people I worked with. It just, I was reassessing my career goals and what was making me happy. And the education was, and the clinical duties were also great. And I found it a great place to practice, but I wasn't sure from a professional standpoint where I was headed. And also on the personal side, we had just had my wife had given birth recently to our second boy. We have 2 boys now that are 3 and 6. She had been wanting to move to a smaller city at some point. I'm from New York City, so that scared me a lot because I'm used to more, and San Francisco to me is a small town in comparison to how I was raised. But the combination of those things, I started looking, and some of my friends had recently left UCSF to go help start the fellowship at Kaiser Permanente in San Francisco. And so talking to them and a job opening up in Santa Rosa, I was able to continue to do fellow teaching, but I'm interested in more leadership and management type of things. There seemed to be, as a bigger organization, more opportunities and roles for that, which was my interest. And so the job made sense for both professional and personal goals. And so now I'm up here in Santa Rosa. It's a very obviously clinical heavy job for me because I'm in my third year, I guess, 2.5 years in. And so it's pretty much 50-50 time between clinic and procedures. But I take a day off every quarter, a little less than that, and go down to San Francisco to teach the fellows simulator training. I was able to set up a wet lab and do pig, intestine, stomach for the second year fellows this year. And so I had a lot of freedom in what I want to do, both professionally. And so it's been a very good balance, and there definitely, for me, and being in a kind of more in a larger organization, seem to be more avenues for what I wanted to do. And so it's been a very good transition for me so far. And this is Damien, my 3-year-old. You can say hi. Hi. All right. So yeah, I've been very happy. I mean, I love UCSF, and this is not a knock, but this is we'll talk a lot about the different systems, but as the Kaiser system for me works very well in that it's integrated and it's very clinically heavy. I try to be if you're an efficient person, it works very well for you, but it is a heavy load clinically.
Awesome. Thanks, Dr. Baumgardner. Maybe Dr. Purohit, you want to?
Sure. Thanks, Jeff. That was great hearing that perspective. And thanks, Margaret. So my story is kind of simple. I finished fellowship in Michigan. My husband was in tech, so he wasn't leaving Silicon Valley. So I had to move to California. My first year out, I did know graduating as a fellow that I did not want to be in academia. I wanted to be a clinician. And around the time I graduated was a fear around private practices. The trend was to go with bigger organizations like Kaiser, especially in California. So I got a position with Dignity Health, and it was great. It was in Santa Cruz. It was reverse commute. We were living in San Jose. Dignity is a great system, but there are a lot of things you realize with your first job after you start the job. And so I was the only gastroenterologist feeding 40 primary care providers. So it was a little uneven in that setting. And there was a lot of initial setup that the practice needed, which was great learning for me. But over time, I realized that I probably fit better in a private practice where I have a cohesive group of physicians around me, and there is somebody experienced around me who I can go to if there's a difficult situation. I did advanced procedures, and I still do. And with the ERCPs, I always thought it's good to have somebody watching my back. Around that time, there was an opening in San Jose GI where I'm currently. So I was only 8 months into my first job when this opening came. And there was a lot of doubt in my head because you have this feeling if you switch around jobs too quickly, maybe you're not stable. But I interviewed with the group. There were 4 physicians at the time, experienced. They seemed like a lovely group, well established in the community. They had been around for 15 years when I started with them. So I made the leap, and it's really been the best decision for me. I've been with San Jose GI since 2017. It's a great group of people. We've grown from 4 to 10 physicians. Life is similar to what Jeff mentioned. We have a very heavy clinical load. Efficiency helps. Private practice is a lot about numbers and the patients you see. So it's a good mix of clinical stuff. We do some hospital call. It's not too heavy because we're 10 of us, so it's equally divided. So I would say that the stuff I really enjoy is working with a great group of physicians, having a lot of autonomy. Being in private practice, you get to make a lot of decisions. Like, I don't work Fridays, and I love that. And nobody can take that away from me, except when I'm on call. So, you follow standard of care, but you have a lot of independence. So I like that. In the pandemic, we did realize that being a smaller group, there are limitations with access to resources. And that was a little bit of a struggle. So yeah, it's a balance, but I do think if you go for private practice,
Is she frozen for you?
Yeah, it looks like
Oh,
she's
no.
frozen.
Okay, let me make sure.
should be taken into account.
I'm so sorry, Dr. Purohit. I think you froze for the last 30 seconds. Can you just repeat what you were saying?
Oh, I was just saying that the things to keep in mind when you go and interview with private practices is to make sure they're well grounded in the community. They've been around for a long time, and it makes a difference if it has a good mix of clinicians in terms of how many years they've been out. And those are the things I took into perspective, and I think it's been a good decision. And that's it. Thank you.
Thank you so much for sharing that and that bit of wisdom. I think that's something that I hadn't heard before, so I think that's really good insight. Awesome. So next, maybe Dr. Saxena, if you can take us through your journey as well.
Yeah, sure. Thanks, Margaret, for the intro, and Jeff and Treta for sharing your stories. As Margaret pointed out, in my sort of training, it was all UCSF all the way through. And, I was really mentally grooming myself for an academic position. And during the GI fellowship years, I did the T32 with the full plan to apply for a K and, go down the clinician researcher pathway, which really at a place like UCSF is capital R with research. And, when it came down to sorting out, what a job would actually look like, there were some things that were not that attractive to me, in that, I didn't really love being beholden to an RVU model, which certainly is a big part of academics nowadays. And then, for most scenarios, there's only a certain amount of RVUs that are available within a group. It's very hard to sort of expand beyond what is generally collected in a certain year. And so, at least for hepatologists or transplant hepatologists, it was really driven by how many service weeks you could get on the liver transplant service, because that's where you really collect most of your RVUs. And so, the researchers would have to really buffer their RVUs with grants. And, UCSF's great. I also, was contemplating joining UCSD. Margaret, I know you're from San Diego. And, both systems have, very similar approaches, which is their junior faculty, they will kind of offer some protection and buffer to your RVUs. But, if you don't actually get those grants, within a couple of years, you basically just have to kind of give up research endeavors and fill your time with, clinical work, which I was kind of not sure that was what I wanted to do. And, while I was interested in joining UCSD, my wife is also a physician, and, she had a great job already at Children's Hospital Oakland as a pediatric neurologist. And, there were some geographic ties that kind of kept me here. And so I ended up taking the job at Kaiser in South San Francisco, and, sort of not really knowing exactly what I was getting myself into, and whether it was going to be the right fit, to be completely honest. But it actually turned out to be a really nice fit. For a lot of the reasons Jeff pointed out, I think Kaiser does offer a lot of advantages. You're in a group practice, so you do have people that back you up, which I think was a really good point, particularly when you're starting early and, ramping up your procedures and, trying to figure out whether you want to EMR the polyp that you're staring at or not. And, you've got a couple of patients waiting, call on a colleague, and it's super nice to be able to do that. I also think that I landed in a place where they really valued a subspecialist within a subspecialty. So, I actually in clinic only see liver patients. I don't see any general GI, and that's not that common in the Kaiser model. And I think Kaiser, at least in Northern California, is really starting to move in that direction. Kaiser in Southern California already has that model where they actually have centralized their transplant hepatologists at Kaiser Sunset. And so it ended up being a really nice fit. And then the other piece that was nice is that Kaiser, at least in Northern California, has a very robust division of research. And, I was able to sort of still keep my research interests going and creating this hepatology research network here, where we can apply for grants and answer questions that are very clinically appropriate and, things that we're facing on a day-to-day basis in our clinical practice or in transplant board, et cetera, but not sort of feel like if we don't get a grant, something terrible is going to happen, where you have to sort of readjust your whole sort of career pathway. And so it's like being able to do research, but like a lowercase r instead of that capital R that a lot of these academic centers do tend to kind of fall back on. And the other thing is administratively, Kaiser does offer a lot of opportunity for growth. It is unique in that pretty much every layer of the physician group, the sort of administration are MDs, so they've all done kind of the work clinically and then sort of start to move up slowly. And those opportunities exist for people that are interested in, sort of hospital administration or creating policy that has major impact on a very large swath of patients. On last count, Kaiser Northern California has almost 4 million adult members, and I think is responsible for 35% of insured patients in Northern California. So definitely the largest insurer in Northern California, and it's really quite amazing to be able to work on policy, at least from a hepatology perspective, that has such a big impact for so many patients. And so really good natural fit. I do miss some pieces of academia, but I'm able to go over to UC once a month and teach. And then I also go to San Francisco's Fellows Clinic for advanced liver care once a month as well. So still have those opportunities, but not as much as I probably would have had in an academic setting.
Awesome. Thank you so much for sharing. It sounds like you've really found a great balance of, the things you love about medicine. So it sounds like a great place. So now, Dr. Wong, if you'd like to share about your experience as well.
Sure. So it's actually so nice to hear the Jeff, Treta, and Varun. And I think that as I was listening to all three of you talk, each of us had different paths, but I think there are certain aspects, I think, of sort of a decision process and decision tree that I think is very, there's a lot of overlap, and I think in this journey. And I think as we each sort of expand on the journey, our process, our thought process, I think it's so interesting for the fellows to sort of see the common themes that are present. So my journey, I think in the beginning was sort of similar to Varun's. After finishing fellowship and doing a master's, I was also on a T32 and sort of kind of heading down the instructor path and, sort of that academic research track. But similar to, I had very similar experiences to Varun, and my job process actually didn't really start until December, January, which is quite late in third year, because I sort of had this assumption that I would probably just stay on as instructor. But, as I thought more about the process of transitioning from fellow to instructor, some of the themes that I think caused me to pause and maybe reassess a little bit were similar to some of the themes that were brought up. The transition to an RVU-based model, which Stanford was and is similar to UCSF, was something I wasn't sure that I wanted to immediately jump into. Also, the complete reliance on grants for salary and compensation. There is, as junior faculty, as Varun mentioned, in many places, there is a period of protected time where you're sort of guaranteed and supported without the burden, I guess, of clinical work so that you could focus on building your early research career. But it varies across institutions how many years that can potentially last. And when that period expires, you really have to show for yourself. And grants, as all of us know, are not easy to come by, and it's becoming more and more challenging with federal grants and such. The other aspect that I think was definitely at the forefront, and I think this is something that if we have time later, it will be important if we could expand a little bit on it, because these questions have come up amongst the fellows, is compensation. As a transitioning, at least at the time I was graduating, transitioning from a fellow to instructor didn't necessarily translate into a big difference in salary from a third year to a first year faculty. And, living in the Bay Area, housing, everything, it at least for me, it definitely caused me to pause and reassess a little bit. So I ended up moving to Highland, which is a county hospital in Oakland, similar to SF General. And it was a really early program at the time. And I think one of a few reasons that I ended up there, one is I love that population. Much of my work and interest has focused on disparities and underserved. So it was a opportune population for clinical care, also to develop clinical research ideas. The other opportune timing aspect of it is the program was fairly early at the time. I joined as the third full-time GI attending. So there was a lot of flexibility, and our chief was very open to allowing us to sort of build our day-to-day. Of course, we would have to satisfy the clinical requirements, but there was a lot of flexibility in building admin time and building that around whatever your interest is. And for me, it was research. And definitely we were able to build a pretty robust research program at Highland. But as all health systems transition, it definitely has become more mature and moved to a very much RVU-based type model. And my passion and I guess interest in research hasn't dissipated yet. So I was still very interested in continuing to pursue the potential research career. And it just became more and more challenging to do that at a non-traditional academic environment. So I was lucky to be able to move to the VA actually in the middle of the pandemic last year in June. And many of us here have trained at VAs, and I think it offers a few different benefits and balances that may I think resonate with different people. It definitely has the resources to build a research career. It definitely have been more successful in getting federal grants. The VA has its own internal grants, intramural grants. So it makes it, it just creates more opportunities for federal funding. I think the other nice thing at the VA is it definitely incorporates teaching. So for us, it's a core site for the fellows, whether it's endoscopy, inpatient, and that's something I definitely am very passionate about too. And something that, for those of us that start thinking about grant and funding and those sorts, the nice thing about the VA that some may not be aware of is for grants, you don't necessarily have to buy your time, so to speak, because your research time is already built into your day-to-day work and salary. So as if your appointment is primarily through the VA, your research time has already been bought, and it sort of relieves the anxiety of getting grants. If I get 0 grants, I would have similar research time and similar and unchanged salary. And if I get more research grants, my salary doesn't change. I just have more resources to do research. So, there's definitely pros and cons. I think, if the others feel comfortable talking about this, I think compensation-wise, I think compared to private practice, compared to Kaiser, VA faculty salaries are less. Jumping from Highland to VA, I think I probably took about maybe 15 to 20% base salary cut. But the balance of that is, we have more protected time for research. And I don't know, I think at least at the VA in the past 18 months, better quality of life in terms of balancing research and life and clinical workload. So maybe I'll just stop there and see if there's any other input or questions.
Thanks so much for sharing, Rob. And thanks to all of you for really, I think, being, honest about your journeys and talking through your decision points and kind of, how you navigated the balance between, what your personal and your career goals. So it's been really, really helpful to hear. There are not any questions in the chat yet, but I guess something, someone did just text, let me see. Private equity buy and consolidate private GI practice. Maybe I will see if that becomes more of a question, or if you want to clarify your question, feel free to unmute yourself. But in terms of, when you were looking for your first attending job, I know that some of you were balancing kind of the research time, trying to, make sure that you had enough time for teaching. And so, as we become third years and we start to look for jobs, are there, specific things that you kind of wish you had looked out for a little bit more when you were looking for your job? or taken into consideration when you were looking for that first attending job that you might advise us at this point?
I think Treta also mentioned this, but I want to back her up on this, is that your first job is your first job. It's not your last job. I don't know the numbers specifically, but a lot of people change their jobs within the first 2 to 3 years, and that's okay. I did, and I have a hard time with change, and I'm very happy that I did. But I think, one of my attendings when I was a first or second year mentioned that to me, and I kind of like nodded and smiled and I didn't think that was for me because it's not how I have typically operated. But just keep in mind that when you are taking a job, 2 things. Remember that to do the best job for what you are thinking is your role, what your interest is at that time, with the knowledge that you can change your mind, and that's okay. And don't worry that you are going to do something else as you realize that you have other interests, or that the system isn't as suited to you as you thought it was. So pick the best job for yourself, but also be really honest with yourself. I mean, had you really pushed me, I would have said, I know I'm not really an academic. I've just been raised to be an academic. And that's why I think I need to be an academic. But I had to explore that for myself. And academics and teaching are still really important to me. So I was able to find a job that gives me a little bit of that balance. So sorry, I won't ramble too much, but be honest with yourself about what your real needs and desires are. You can take it back later. Be honest with yourself what you actually are interested in, but also recognize that that can change, and pick the best job, what you think is meeting your needs at the end of fellowship.
Yeah, I would echo a lot of what Jeff said. And I think the only other piece of advice is, start thinking about it early. I think actually sometime mid-second year is a good time, for the GI fellows to really start exploring exactly what it is that they, envision for their career and their future. Because, if you're a little bit like me, I also didn't really think about it until somewhere mid third year. Actually, no, sorry, somewhere mid like transplant hepatology year. And I was like, oh my goodness, I have to actually, figure out all of these pieces. And, I've just been at one place for so long, I didn't really even understand what was out there. So, I think start early, and then try to see what things actually refresh you. In every job, there's going to be pieces that, are not going to be anybody's favorite. That's just the nature of, being a physician and jobs. But, really trying to hone in on that 1 or 2 things that will keep you going, because it's, it's going to be a long career. And, we're so used to these 3-year stints with training, and you kind of get this sense of, oh, well, I'm just going to be here for 3 years, and you can kind of deal with anything. But with the job, I think it's really trying to figure out exactly how you're going to sort of keep your longevity going, and try to pick a job that caters to that.
One question maybe I can ask that I'll actually ask all of ourselves, but that the fellows sometimes ask, as fellows, we don't get a lot of training or tips on negotiation. And I think each of us started in a like Jeff, started at UCSF, and Varun started at Kaiser, I started Highland, and Dr. Purohit started at private practice. So I'm curious to hear each of us talk about what can you negotiate, and what do you negotiate for, and how that sort of that whole process works.
It's a great question, Rob. You want to start by answering your own question?
Yeah. So when I had no idea coming out of training, this whole process, we're all sort of used to being told where we are going for training, and we match at one spot, and that's it. We just deal with it. So when I was looking, actually, I interviewed at a lot of different type of settings, and I didn't really realize how negotiation played into it. When and Varun will know more about this. When I interviewed at some of the Kaisers, sounds like there wasn't a lot of negotiation, but there was some flexibility depending on each center and how you build your practice. At Highland, the salary and compensation were not negotiable. There was some flexibility in moving expenses sometimes, but I was not moving anywhere far, so that was sort of discounted. Some places offer signing bonuses, and I don't know, maybe I didn't ask aggressively enough, but I was basically told that it's a salaried position, it's the same, and there's really no negotiation for sign-on bonuses. The only kind of really thing I was able to negotiate with is time and potential resources. And county hospital doesn't have resources, so it's more about time and your clinical workload to try to build some time to do research. It was not in writing. It was sort of very informal, but for the most part, I think our chief sort of honored that as much as he could. So sort of that was my experience joining a non-traditional academic sort of county setting.
Treta, I'm curious on the private practice side, not to put you on the spot before the two Kaiser docs start talking.
Yeah, I think, I mean, from my understanding, you probably have the most experience with potential negotiating as a
yeah, probably. So yeah, I guess I did not interview with any academic institutions. There was Dignity in the beginning, and Palo Alto, PAMP, which are kind of big systems but still private practice. So it's a little similar to Kaiser, not much movement on the base pay because they already started a very competitive number, which the fellows will realize when they start interviewing. And remember, when you're out of fellowship, all these numbers look really big. So, take that into perspective, right? And so after the first time, you're like, okay. And so there's regional differences in compensation. Most of the private practices try to be competitive. So the base pay wasn't much of a negotiation, but yes, I was moving. So there's a little bit of leeway with moving expenses, if you were to say. I think one of the important things to look in as a fellow is also to look in how many calls you will be taking as a newer person on the practice. Sometimes as people are, semi-retiring, they may be taking very minimal call. So you want to make sure in the contract or when you talk to them, you're not carrying the load of excessive call compared to the senior partners. And if you feel that way, feel free to open up and talk about it. That am I taking double call than everybody else? Am I paying my dues in the first 3 years? These are very practical questions, and they lead to young physician burnout in the first 5 years. So think about all of that. From moving from the bigger institutions to the smaller to medium practices like ours, now that I have worked as a director and I've recruited 3 associates, I can tell you from the offering part of these practices, we always start at a number where there is room to negotiate, because most of us expect a counter when we interview candidates. So always remember, at least with private practice, there's always room for negotiation, and within reason, if the practice really likes you, they're going to meet you somewhere in the midway. So don't be shy. These are awkward conversations. None of us like to have those, but these are important, especially if you're going to be in Bay Area or New York City, right? Some of us in private practice start with 2 years of a base pay, which is not going to change for the first 2 years. So those things are important. And after that, I think it depends on the private practice model. So ours is a model that kind of benefits everyone, where there's part ownership in surgery centers, radiology, and then you work and you do your professional services. So if you interview with a practice like that, it's important to know, like, what is my buy-in period? Is the buy-in extremely expensive? Those are big questions that come up later. And practices may not give you all the numbers, but if it's an integral group, they're going to be honest. They're going to say, well, it's a number you will probably be okay shelling out in 2 years. Sometimes there's a buy-in period. They say, well, in 3 years, you can slowly buy into the practice for this percentage. So it's a lot of numbers, but my experience was never be shy to ask these questions. Nobody teaches us this in training. And so take your time, speak to your own faculty. I think those are our best resources. So I got my program director. I don't know if he hated me for it, but I showed him my contracts and I was like, what do you think? Is this a good idea? And then, so I think those are good conversations when you're interviewing, because your faculty is your friend. They'll back you and they'll also show you red flags. Yeah.
That was wonderful. I'm going to echo just a couple things and a couple slightly different perspectives. One was, looking at the UCSD academic contract and kind of reviewing that. I really strongly agree with the idea of, talking to a faculty member that you really trust. At UCSF, it was Jennifer Lai, who also had an MBA and was very business savvy. And, one of her main lessons when we were doing the negotiations for that UCSD contract was, definitely for academia, that first contract is highly negotiable. And if you don't ask, you're kind of a sucker. And so you should, treat it like something, not only are you really lucky to get that offer, but, almost that you really need to negotiate. Otherwise, they're going to take advantage of you up front. And so from the Kaiser side, as a chief, we actually just hired somebody. It was one of the things I did as a chief. And it's true that, sort of base salary and signing bonuses are not really negotiable. There are some medical centers within Kaiser that are sort of under staffed, and they do have leeway with HR to sort of offer kind of signing bonuses and larger moving stipends. But base salary is pretty universal. But what you actually can negotiate within Kaiser, which is not really well known, is sort of the structure of your time and your job. So, you don't necessarily just have to do sort of what everybody else is doing, but you have to sort of tread that lightly, I'll be honest, because at least from our hire experience that we just did recently, I mean, we get a lot of applicants and they're all really, really good. And so if we kind of get a feel that someone is really trying to, carve out this perfect job from the get-go, we're turned off a little bit. And, so there's a little give and take there. I don't know, Jeff, if you want to, go ahead.
Yeah, I mean, at UCLA, when I worked at San Francisco General, it was, in both places, it's really not, there wasn't much negotiable on the salary or how much time necessarily you were going to work. But with echoing what Varun says, but I think it's important that you make it clear from the beginning what your goals are and what you want to do with your time. And so in certain situations, you may have some leeway to negotiate what your salary or your benefits are. Where I have been, that was not negotiable, which is fine. But I found that maybe I wasn't clear enough in my first at UCSF and San Francisco General about that I was very interested in the pathway that led toward leadership management. And so I don't know. So that's why I didn't go there. And so when knowing that about myself, going into the Kaiser, talking with the Kaiser, with the chief up there when I was looking at that job, I made it clear that I was very interested in spending not a lot of time, but some time going down to San Francisco and teaching the fellows, and depending on how the fellowship went, bringing fellows up to Santa Rosa. and he was very supportive of that. And I made it clear that, I was not there to take his job in any way, shape, or form, but I was interested in opportunities within leadership and management. And because of the Kaiser system was attractive to me, because being a corporate and a corporation, having more avenues for it was something that I would be interested in pursuing. And so I made that clear early on. In your first job, you may not know what those are. You may not feel as comfortable asking for that. But every job, you're supposed to, have a performance review or some talk with your chief. And so as those become clearer to you, make that as crystal clear as possible, so that you can build that into your time, and pursue those goals and have the backing. And if you don't have the backing, and those are things that are important to you, that should be a red flag, is potentially too strong, but it should be something that catches your attention and makes you think, is this really the place that I want to be, or are there better places for me? So on the negotiation side, you may not have much leeway on money or benefits, but you should be clear about how you want to spend your time, how much procedures, how much clinic, what kind of clinic, what leadership, what education type time, so that you're going to have to do things that you don't like, but if you can be honest about what it is that you would like to maximize, if you want to see more IBD or more liver, maybe that's possible. It might not be. We just hired someone who did an IBD year, and we already have an IBD person. But I'm going to give up some of my IBD stuff so that he can be happy, and I'm fine with that. I mean, I like IBD, but things can be done so that we can construct a job around your interests, as long as you're clear about that. And if it's not, it's hard when you start a job because there's a lot of things flying at you. But I think clear communication about that is important.
Awesome. Thank you guys so much for being honest, and all this advice is very concrete and I think will benefit us greatly while we look for jobs. We do have one question in the chat. So it does sound like we have a couple of our panelists have been part of hiring physicians. And so on the other side of the table, what are some of the factors you have considered when evaluating applicants, and what are some things that make applicants stand out?
Treta, do you want to go first? Okay.
You go.
I'm assuming staying muted means no. Okay. So it was a new experience for me, being on that side of things. And I would say it was the things that I learned were that I kind of, was really initially heavily focused on the CV. And I think, schools that people go to, their training, sort of the concept of a track record. That was really how I approached the process initially. But, in the end, I think the intangibles that ended up, leading to our hire were, two really important things. One was, fit. So being, kind of getting a gauge if you're on the fellow side, applying of, the sort of tone and the way the group dynamic is, and sort of seeing if that's a fit. I think certainly on our side, that was a big piece, is just, do we get along? I mean, you're going to be spending potentially the next 20, 25, 30 years with, this person. Especially at Kaiser, once you get partnered and the golden handcuffs come on, people are here for a very long time. And, you want to be able to know that that's somebody that is a team player, understands, what it means to sort of, at times, sort of sacrifice what it is that they want to sort of help out a colleague and back and forth. I think those pieces are actually, understated and ended up being really, really important. And then, we, with our hire, we also, wanted something specific. The group, felt really good about liver care. They felt like they wanted someone to sort of bring our IBD care to the next level. And so, we ended up, really searching for someone that had a lot of passion for IBD and was interested in jumping into sort of developing and running an IBD program. Because honestly, right now at our medical center, it's not very programmatic how we're dealing with IBD. It's more like, putting out fires and flares and crises and, maybe a couple follow-up visits here and there. But we wanted something a little bit more programmatic, from a quality perspective. And so I think, trying to figure out also what the group may be looking for it's in your benefit too. And that ended up playing a big part of who we ended up selecting.
Awesome, thank you. Dr. Purohit, do you have anything to add?
Yeah, very similar to what Varun said. It starts out with the CV and the credentials and all of that, but it boils down to the personality, how much of a fit you are to the practice. And doing these interviews during the pandemic, what we realized was that when we were getting all these applications, we started looking at local ties. So if you're training in Utah and you want to interview in the Bay Area, we really need to know, is there a reason you want to be here? And it's not just you've entered something in the job search engine and you're just applying. Most of you are very serious fellows, but sometimes we need to know the reason for you to be here. And I think sometimes fellows don't realize that when they send out their application. So it becomes a part of the process where if you write a cover letter and you tell us why you like the practice and why you want to be here, and is there a subspecialty, like Varun said, you're interested in it, that really makes your application stand out. We did a lot of Zoom interviews. So I think good Zoom, like have your tech set up, audio, all of that really helps. And then post-interview follow-ups also, because we finally flew in only the candidates that the group really liked. So I think after the interview, the email that was sent out, how the references played out, all that played a part into who was actually coming in to see us. Which has changed a little from the pre-pandemic times where it was much more loose, where we would get more people easily. So I think those are the things. And then again, make sure that you have the criteria that the practice is looking for, because only then the fit will survive long term. So yeah.
Awesome, thank you guys. Something I was also kind of wondering about is, Dr. Saxena, you said maybe it would be great for fellows ideally to start early, halfway through second year potentially. That's scary to me, to start thinking about, jobs and kind of what you're really looking for in terms of a job. And something I was wondering is kind of where do you hear about job opportunities that might be a little bit outside of, what we're used to in the academic sphere? Were you kind of hearing about them from faculty members, from fellow friends, and where were the opportunities you found both during fellowship and then when you were already in your first job, for those of you who had a prior job?
Margaret, I don't want to raise anyone's anxiety level, so totally want to rephrase what I was trying to say with that piece. Is during sort of midpoint second year, I think is a good time to do your own self-assessment and start to really, just try in the back of your mind, kind of process, what it is that you may be looking for and what it is that, you're attracted to. And, keep that process ongoing in some form or another during the second year. And then realistically, you start looking, at the beginning of your third year for, true jobs. So sorry
for clarifying
about that.
Sorry.
Yes.
Yeah.
And then I would say that your program director is a very good start. They actually often get quite a few people reaching out to them about graduating fellows and opportunities that exist. They certainly in the Bay Area, a lot of people know a lot of the people that are offering jobs, and so that communication is a really good approach. And then I think conferences, honestly, there's quite a bit of networking that happens at conferences, and they often lead to job interviews down the road. And so I do encourage, if you do go to conferences, present or not, put yourself out there, talk to people, and just, learn about what their practice is like, and, where they landed and why they landed there. And then I would say for Kaiser specific, the main sort of arbiter of jobs is we do have a recruiter, and Kaiser Northern California holds a number of recruiting sessions, and they're always abreast of all the positions that are actually available. The ones that are about to be available, they may not know, but things that are actually listed, they'll be aware of that. And you always have to go through the recruiter, even if the chief of a medical center really wants to interview you like tomorrow, you still have to go through the recruiter and put in the formal CV and talk to them and, go through that process.
Yeah, the only thing I would add, oh, go ahead, Robert.
Oh, no, go ahead.
I think all the points Varun said were things that I used in my job search, and then the AGA career website, I think, is a great resource. Both my job interviews that I eventually joined came through the AGA search. The filters are great, and that's a great resource too.
Yeah, the only thing I would add is, especially if you're not moving out of the region. So if you're staying in the Bay Area, when I was contemplating moving from Highland, Bay Area, there's always very few, if any, jobs that are actively posted. But it doesn't hurt to reach out to people that you might know or someone you may have trained with, and just put out a feeler. And sometimes there are no openings, but if the question comes up, suddenly there may be an opening, or you might sit down and have coffee with someone and they may be able to create a position for you. And that's sort of what happened when I was moving last year.
Awesome. Thank you, guys. So it is 6:58 and I want to respect everyone's time. But thank you all so much for sharing your stories and your journeys. It's been really, really helpful. I'm sure for both me and everyone on this call. So thank you again for taking the time. I do want to put a plug before I forget for fellows to submit their abstracts to the Liver Symposium. Oh, it's on the next slide here. Oh, and our next meeting will be in January on AI innovations in GI. Where is that? Oh, here. So the deadline for abstract submissions is January 3rd. So please do submit your abstracts, everyone. And thank you all for everyone who's been part of making this happen. Follow us on Twitter, subscribe to YouTube, and thank you all again for a great webinar.
Awesome. Thanks, Margaret.
Thank you very much. Thank you,
so
Margaret.
much.
Audience.
Great.
Appreciate it.
Bye.